Good morning, everyone. Welcome to Backyard Musings, broadcasting live from Apple Valley. I'm Steve.
And I'm Scott.
Thank you for joining us today. This segment is near and dear to my heart because I have sleep apnea and I wear a CPAP machine. Researchers have found that obstructive sleep apnea may be a modifiable risk factor for developing the wet form of late-stage age-related macular degeneration, where your eyesight just starts to go
Okay.
bad.
So, question: Do you wear glasses? Do you wear contacts?
Well, I wear readers. I used to wear glasses, and my eyes have been surgically enhanced, so I wear readers.
So, okay. So you've had some kind of LASIK surgery or something like that?
Yes, my eyes have been surgically enhanced.
And did they tell you? Because I looked into that because I've worn glasses for almost my entire life, 10 years old, and so almost my entire life. And I was told that could help me, but within a few years, I'd probably progress to have to wear glasses again.
Well, so that's partially true. So when I first got right after I came out of the surgery, I got up off the bed and I looked at the clock and I could read it. You know, their surgery bed or whatever. I could read it without glasses.
You wouldn't have been able to do that without
no.
some kind of lenses.
Yeah, wouldn't have, an hour earlier I wouldn't have been able to do that, and so it would have been all fuzzy. And so, but as the years progressed, my eyesight went from 2020 to 2025, and so I have to squint. Sometimes I have to squint like to read like a street sign. I might have to squint a little depending on how big the letters are, and when low level lighting like at dusk or dawn, that it's hard for me to see too. But as the years progressed, it just got a little bit and a little bit and a little bit worse. But I'm still a 2025, and because of the surgery, I've always needed readers to read up close, as a side effect of improving my farsighted, my ability to see far away.
So you were nearsighted; you couldn't see far away.
Correct. And up close, I could put the book and I could read the book beautifully before enhancement. Afterwards, I need readers because it would just hurt my eyes trying to strain.
Okay. Sorry to just because I don't think I've ever seen you wear glasses. So.
Yeah, well, I do occasionally, and I've got like these. They're not bifocals. They're called what are they called? Progressives. They're called progressives. So you can't see any bifocal at the bottom. They just gradually go into my 20/20 sighted lens, which is the top part of the lens, and then the bottom part is like some reader. So I can take, if you look at how I'm looking at the screen now, if I go like this and I look down, I would be able to read perfectly, but then I'd have to go like this to see normally. You know what I mean?
That's what I wear. I wear progressive lenses.
You wear progressives?
Yeah.
Oh, they're beautiful.
I went from wearing regular, I know this is kind of not really on topic here, but I went from wearing regular glasses to, I never went to the bifocal, trifocal thing. I went to progressives. So.
Oh yeah. They don't make you look like a nerd, and it's beautiful. It's wonderful.
Yeah. And I mean, if you get up close enough to the lens, you can see where the changes are. But you can't tell just by standing within a couple feet of somebody. You can't tell. So
yeah, somebody would have to be trying to kiss you to see the changes.
Yeah. We don't allow that.
Doesn't happen. Only my wife she's the only one that's allowed to do that. Okay. Age related macular degeneration is a common eye condition and a leading cause of vision loss among people age 50 and older, like me and you, Scott, and many of our fans that watch the show. It affects the macula, which is the central part of the retina responsible for sharp central vision needed for activities like reading and driving. Wet AMD is less common but more severe. It occurs when abnormal blood vessels grow behind the retina and leak fluid or blood. damaging the macula. These findings were published in the RANSCO Journal of Clinical and Experimental Ophthalmology. The study was led by University of Melbourne master student Atika Chaudhry, along with the Macular Research Unit at the Centre for Eye Research Australia, headed by Professor Robin Geimer. The team collaborated with sleep disorder expert Professor Matthew Naughton from Monash University to analyze the results. Would you like to know more?
Yeah, so just those points that you pointed out there about the abnormal blood vessels and stuff, those are the reason that everybody should go have their eyes checked.
Yeah.
Even if they're not having issues with blurry eyesight or whatever, they should have that checked out, because I know when I go to my optometrist, she looks deep into my eyes, and she's told me that, you got the beginnings of cataracts, or there's been other optometrists that have noticed things in my eyes, and they say, it's not critical or an issue right now, but just need to be able to, check that at least once a year. So I'm really pro on
and that check requires they put the drug in your eye, which forces your iris to go wide so that they can look back onto that. It's annoying, because you're light sensitive, but it's necessary to diagnose that,
Yeah, well, they've actually the last few years I've been able to have that checked without having my pupils dilated. So it's been I mean, obviously I think they get a better reading when they do dilate your pupils, but they've come a long way with like light refraction and all kinds of stuff. So but it definitely something that we need to check out. So keep up on. So the researchers conducted a sleep study involving 225 participants aged 50 and older, each at different stages of AMD. Over 3 nights, they monitored participants' oxygen levels using a home-based finger oximeter and assessed their level of obstruction sleep apnea based on overnight blood oxygen levels.
Let me go in there a bit. That oximeter on your finger is annoying as all get out. I mean, it's on your finger, and it takes you like an hour or two just to get to sleep because it's on your finger, and you get annoyed by it.
So it's similar to like a pulse ox gauge, right? Or same. So I mean, I've had those on there, my fingers, a few times. I mean, it can be annoying. I have never tried to sleep with one on my finger.
Yeah, it's annoying trying to sleep.
Okay. The study revealed that moderate to severe OSI or OSA, categorized by reduced oxygen levels during sleep, was linked to a higher risk of developing wet AMD compared to individuals without the condition. Study co-supervisor Dr. Carla Abbott says the findings are sometimes clinicians some should be aware of. So that's
they should be looking for them.
Yeah, this is good. This is good stuff. I think this is great.
Okay, here's a quote for you. Like AMD, sleep apnea mainly affects people over the age of 50, and many people don't realize they have it, end quote, Dr. Abbott says. Quote, if this association is validated, it may well be worth asking people with high-risk early stages of AMD if they have any symptoms suggestive of sleep apnea, as treating it might reduce the risk of developing wet macular degeneration, end quote. Nocturnal hypoxia often occurs as a result of obstructive sleep apnea, where a person's airway becomes blocked or narrowed overnight, reducing their oxygen intake. A lack of oxygen overnight can cause various health issues over time, but the light-sensitive retina in the eye may be particularly sensitive to small drops in oxygen levels. Quote, the retina is very active at night. It has its highest need for energy while it recovers from the day, end quote, says Dr. Abbott.
See, I wouldn't have even known that. I wouldn't even thought of that. Why would your retina, when your eyelids are closed, I don't know. That's pretty bizarre. So many people diagnosed with sleep apnea use a CPAP device at night, like you just said, which helps them breathe easier by providing a constant flow of air through a mask. Quote, if people aren't currently getting treatment, it's putting them at risk over years of not sleeping properly and having low oxygen at night, which could be contributing factor to molecular degeneration, in particular wet AMD, says Dr. Abbott. Currently, known risk factors for AMD include smoking status, diet, age, and genetics. Dr. Abbott says the team will need to conduct larger studies to better understand this association, and if validated, will explore whether treating sleep apnea has a clinically meaningful impact on reducing progression to wet AMD. The work is part of the wider Synergy high-risk AMD study, which is investigating macular degeneration and the potential underlying causes that make some people more likely to lose their vision. So,
okay, in case you didn't know, sleep apnea is a potentially serious sleep disorder where breathing repeatedly stops and starts during sleep. There are three main types. Obstructive sleep apnea. This is the most common type and occurs when the throat muscles intermittently relax and block the airway during sleep. Central sleep apnea. This occurs when the brain doesn't send proper signals to the muscles that control breathing. And three, complex sleep apnea syndrome. This is a combination of both obstructive and central sleep apnea.
So people with sleep apnea often experience symptoms like loud snoring, episodes of breathing cessation during sleep, abrupt awakenings with shortness of breath, and excessive daytime sleepiness.
Yeah.
Untreated sleep apnea can lead to serious health complications, including high blood pressure, heart disease, stroke, and diabetes. Treatment options include lifestyle changes, continuous positive airway pressure, therapy, and oral appliances, and surgery in some cases. So,
yeah, my wife uses a mouth guard thing to help with her snoring, and then finally she broke down and got a CPAP. I urged her, go get tested, and she did. So
yeah, I don't know. I mean, I know a lot of people that use these, and I guess I've just never known how they test for it. So, but hopefully taking naps during the daytime when you're a retired person doesn't count. So, just lost. I just lost Steve. Well, I don't know what happened. We lost Steve. I don't know what happened to him, but I'm going to go ahead and sign off. And everyone take care. Thanks for joining us, and we'll see you the next show.